Hello, and welcome to SunSmart Nevada, a program which is building a culture of sun safety and skin cancer prevention in Nevada. This presentation is an orientation for new volunteers to understand what to know and expect when beginning to volunteer with us. So let's go ahead and start with some background history. So SunSmart Nevada is a program of the Nevada Cancer Coalition. And for those of you who aren't familiar with the NCC, here's some basic information to know in case you're ever asked about the organization you're volunteering for. It is a 501c3 nonprofit organization that's working to unite and lead community partners to improve the health of Nevadans through cancer prevention and early detection, education, and advocacy. So what is a coalition exactly? It is defined as a group of people, groups, or countries who have joined together for a common purpose. The reason that the NCC chose to have the structure of a coalition is that it becomes useful for goals relating to reducing various types of cancer throughout the state. So in 2002, the Nevada Cancer Council was formed to develop a comprehensive control plan for the state of Nevada. Funded by the Centers of Disease Control and Prevention, or the CDC, the Nevada Cancer Council was charged with developing and implementing Nevada's Comprehensive Cancer Control Plan. Comprehensive cancer control is based on the idea that people and organizations working together to pool resources and coordinate efforts can effectively increase the prevention of cancer and ultimately reduce the burden of this devastating disease. The NCC develops and executes programs, promotes evidence-based practices, gathers and disseminates information, and advocates for policies to reduce the risk of developing cancer, increase early detection and appropriate screening for cancer, increase access to appropriate and effective cancer treatment and care, address quality of life issues for Nevadans affected by cancer, promote the collection and use of cancer-related data, and to improve the coordination and collaboration between cancer control efforts. At the Nevada Cancer Coalition, we believe in the power of collaboration and partnership, the integrity of science and research, and the essential right for quality in every life. Together, we can improve lives and change the course of cancer for current and future generations of Nevadans. SunSmart Nevada was created in response to the U.S. Surgeon General's call to action to prevent skin cancer back in 2014. The plans for this program involve promotion for sun safety and skin cancer prevention in schools, workplaces, and outdoor recreational areas throughout the state. SunSmart Nevada is being asked to participate in many special events, health fairs, and community runs. Some of these events that we've been to include ACS Relay for Life, Ragnar Tahoe Trail, Reno and Sparks Open Streets, Truckee Meadows Healthy Community Health Fair, and more. And this is where you come in as a volunteer. Because this is such a popular program and there aren't enough staff to meet the demands for outreach, we've created this training orientation to help you learn the info you'll need to table for community events like a pro. This presentation is designed to help you teach others about sun safety and bringing awareness of skin cancer. Because while a lot of people may know about skin cancer being dangerous, they don't always understand that anyone can get skin cancer or that it can be prevented if they're sun smart. So some of the things you'll learn as a volunteer include setting up and taking down the table at an event, knowing things about SunSmart Nevada, and engaging with the public. And if you forget some of the information in this presentation when you're at an event, we have handouts with most of the information in this PowerPoint. Here are some things to remind you for what we look for and advise volunteers about before they help at any events. First, you must be at least 16 years old. Dress prepared for any weather changes, especially if the event you'll be volunteering at is outdoors. We'll be providing a SunSmart t-shirt for you beforehand to help you better represent the program. Bring snacks and water for yourself to the event for fuel. What we're usually looking for are volunteers with a background or interest in community outreach, science, public health especially, or even nursing. Moving on to the physical demands for SunSmart volunteers. So volunteers should expect to be standing for most of the event time, which can take hours depending on which event you're at. It's okay to bring a collapsible chair for breaks, just in case there aren't any chairs provided at the event for the different tables. Because volunteers are going to be setting up and taking down the outreach supplies at events, they should be able to stoop, bend, and reach without difficulty. They also should be able to lift, pull, or carry 40 pounds. This is because the sunscreen dispensers weigh about 20 pounds total, and the 40 pounds is for the Easy Tent, which SunSmart Nevada uses for its outdoor events. So this is what the table display will usually look like at events. You have the tablecloth, the runners, skin analyzer, info sheets, and the pull-up banner, and a sunscreen dispenser or two at the ends of the table. With the exception of the skin analyzer, all these things are essential for whenever the Nevada Cancer Coalition is invited to table at an event with SunSmart Nevada. You can play around with the layout and design of the setup, however. There's no perfect way to have the table displayed, and if you have ideas for how to make it visually appealing to our target audience, give it a shot. The handouts on the table will depend on the audience present in order to avoid creating any scares. For example, we have melanoma resources kept on hand, but only give them out when appropriate for any cases we meet at events. So here's a brief glimpse of the back of the table. I'm putting this into the presentation for you to view so you can see what we use when standing behind the table. Behind the skin analyzer are the translation chart as well as a steno pad and a pen. The steno pad is used for counting how many people stop by our table. It really helps when we want to compare the expected turnout of an event to how many people stop by our table. The bins that we use, as well as a case for the skin analyzer and the display, will go underneath the table, effectively hidden by the tablecloth and the runners we use. One of the key items that catches the audience's attention at our tables is the automatic sunscreen dispensers. And in this video, I'll show you how to set these up for events. First, there will be 2 yellow plastic keys in one of the box sets in the display bin. These are used to unlock the sunscreen dispenser to either turn it on and off or to change the bag of sunscreen inside when it gets low, as we'll see in the demonstration. So first, you have to test out the motion dispenser by putting your hand in front of the black hole on the dispenser. If nothing comes out after 3 seconds, it needs to be turned on. Turn the dispenser to one side and insert the key into the hole. Then twist the key from the lock position to the unlock position and pull the key out. Now do the same for the other side of the dispenser with the second key. Remove the front plate on the dispenser, and go ahead and turn the dispenser on by toggling the switch to the right. Put the front plate back on. Then go ahead and use the keys to lock the plate back into place on the dispenser. Now test it out. One important thing to note is that when you're at an event and getting ready to take down the display and pack up, be sure to unlock the dispensers to turn them off before you set them in the car. The motion of the car can activate the dispenser otherwise and cause quite the mess. In this video, you'll be shown how to replace a sunscreen bag in our dispensers should the dispenser ever start to run low or malfunction while you're at an event. First, remove the faceplate on the sunscreen dispenser. Also make sure that the dispenser is turned off before starting to remove the bag. And once that's done, pull the bag up off the hook and slide the white tab at the bottom to the right to detach the bag from the dispenser. Now take a new bag and line up the hole at the bottom with the puncture in the sunscreen dispenser. Turn the tab to the left to lock it into position. Now tuck the bag into the dispenser and re-hook the bag onto the dispenser hook at the top. Once that's done, turn on the dispenser and replace and lock the faceplate back onto it. And that is how you go ahead and replace the bag in the sunscreen dispenser. So this is the pull-up banner that we set on our table at events. It lists the 5 S's for sun safety, as well as some little tidbits that we like for people to remember.
Okay, so this is our pull-up banner for SunSmart Nevada. We've got 2 bars and the display. So how we do this first is that we go ahead and put the 2 bars together. One thing you'll want to notice first is that for this top bar, it does telescope out. So you pull it up, and then you turn it until it tightens. Then you put the 2 bars together, then stick them in the hole right behind this. And then you pull this part, this little flap up, and you'll see on the back here it says insert. You pull it up, keep pulling, and then you go ahead and you stick the insert onto here. And there you have our pull-up banner.
One thing to note is that these videos will also be on YouTube in case you're at an outreach event and you forget how to do the setup. Another popular item we use at events is the skin analyzer, which helps us determine the condition of a person's skin and allows people to see for themselves just how much damage the sun can do to their skin without any protection.
Okay, so this is the case for our skin analyzer that we use at events for SunSmart Nevada. In the top pouch, we will see in here an extension cord, tape, the skin analyzer chart, and then some makeup remover wipes for sunscreen use, which we'll see in another video. And then in the bottom, opening this up, is the skin analyzer itself. So, to lift it up, lift up by the handle, carefully. And then you set it on the table, grab by the bottom. And the front part, which is covered, is going to be where we have people go ahead and stick their heads under.
After setting up the analyzer, be sure to wipe down the inside and outside of the dark blue curtains with the Lysol wipe before anyone uses it. Whenever this device is brought to events, it'll be handled by either an NCC staff member or a nurse that we work with. But we'll talk about some of the ways that you can also use it with the public in another slide. Before we get started on the educational information you'll want to know, let's take a look at some common sun safety and skin cancer myths. There will also be facts that have been backed up by research and previous studies to counter these myths, which could come in handy when volunteering and talking to people at outreach events. The first myth is that a good base tan will protect skin from the sun. That is false. The fact is that any sort of tan is a sign of damaged skin. Another myth is that tanning beds and UV rays are good sources of vitamin D. This is false. This is an important fact to note because some people will believe that when they go outside, they shouldn't wear sunscreen because it will prevent their bodies from getting the amount of vitamin D that they need. About half an hour outside and the right food will give the body the daily dosage of vitamin D that it needs, and sunscreen will not prevent that. Some examples of food sources for vitamin D include fatty fish such as tuna, mackerel, salmon, trout, or eel, some fortified foods such as dairy, orange juice, soy milk, or fortified cereals, beef liver, cheese, egg yolks, and even mushrooms. Another myth is that skin cancer only happens to older people. That is false. Skin cancer can happen to anyone. This fact cannot be stressed enough. As someone who worked in a skin cancer surgery center, I've seen patients of all ages come in to get their moles and skin checks, and the rates for them needing surgery for skin cancer removal are getting higher and higher, while patients are getting younger and younger. Skin cancer can happen to anyone, and it can easily be prevented with education, awareness, and action. Another myth is that sunscreen isn't needed on a cloudy day or during winter time when you go outside. That is false. Even when the sun isn't visible, UV exposure is inevitable when going outdoors. A few years ago, when my family and I went out to the Santa Cruz boardwalk for an outing, it was a very cloudy, cool day outside. I didn't put sunscreen at all and wore huge sunglasses and sun protective clothing. The next day, however, I woke up with a serious sunburn on my face where my sunglasses didn't cover, and it burned for the next few days. So wear sunscreen whenever going outdoors, folks. Now let's move on to the educational part of the training orientation. As I said before, some of the important information you'll want to know will also be on the handouts that we give to people at events. So don't worry if you don't remember every little fact from this orientation. So out of all the cancers that people are diagnosed with every year, skin cancer is the most common, with nearly 5 million people being treated each year. Some of the most common forms of skin cancer in the U.S. include actinic keratosis, which is a precancerous growth, basal cells, squamous cells, and melanoma, which can cause the most skin cancer deaths. According to the CDC, more than 65,000 people are diagnosed with melanoma each year. So this graphic shows the different types of skin cancer that were listed in the previous slide. One of the resources that we have available when tabling at events is a dermatology wheel. It shows not only the varying appearances of skin cancer like this graphic, but it also shows the texture, which is very useful when people want to better identify the differences in skin cancer. Skin cancer can affect people of any skin color, and it can appear anywhere on the body, including the eyes, underneath the fingernails, and the bottoms of the feet. So for skin cancer in Nevada, due to Nevada's higher elevation and sunny days leading to higher exposure to UV rays, the state's population has a higher mortality rate than the national average. Nevada's rate is per 100,000 people for melanoma is 2.9. The national rate is 2.7 per 100,000 people. Nevada rates of cancer are underreported, so it's likely that the incidence of melanoma is underreported as well. As for basal cells and squamous cell carcinomas, the rates and cases for BCCs and SCCs are not mandatory to report, so there's less knowledge of the frequency of these cases than for melanoma. Anyone can get skin cancer, but some are at higher risk than others due to particular risk factors, such as family or personal history of skin cancer, skin that freckles and burns easily, having red or blonde hair, blue or green eyes, prolonged sun exposure through work and play, history of sunburns, history of indoor tanning, and certain types and a large number of moles. Lastly, but not listed above in this little graphic, is light natural skin color. So here are some more tidbits for sun safety and prevention. According to the CDC, the most hazardous time frame for UV exposure in the United States is between the hours of 10 a.m. and 4 p.m. It's even worse in the late spring and early summer when the UV rays are the strongest. And tanning beds dramatically increase the chances of skin cancer. In the state of Nevada, it is illegal for minors under the age of 18 to use tanning beds in a tanning salon. So this chart helps display the differences between two of the main ultraviolet rays that can damage the skin. On the right, we see UVB, which can be remembered with B for burning. These rays burn the epidermis, or the top layer of skin. On the left, We have UVA, which is best remembered as A for aging or wrinkling. Since it penetrates deeper into the skin than UVB rays do, it can cause long-term damage such as wrinkles and premature aging. One important thing to note that isn't on this handy chart, however, is that both UVA and UVB rays lead to more than just aging, wrinkling, and burning. They lead to worse damage, skin cancer. An important safety tip to prevent the UV rays from penetrating the skin is by applying sunscreen whenever you're outside and exposing yourself to UV rays. With sunscreen, the UV rays are unable to penetrate the first layers of skin, therefore reducing the risk of getting skin cancer. To help promote sun safety practices, SunSmart Nevada has created a little handout with a mnemonic for remembering sun safety, which can be given out at events. It's titled, Be Sun Smart with the 5 S's, and gives 5 little sentences on how to help prevent skin cancer. The first one is to slip on sun protective clothing. Anything that covers the arms and legs is usually the best. Followed by slopping on broad spectrum SPF 30+ sunscreen. Then you slap on a wide-brimmed hat, seek shade or shelter, and slide on UV protective sunglasses. As for the last one, we get plenty of questions at outreach events for why the CDC recommends UV protective sunglasses specifically. This is because it helps prevent ocular melanoma, or melanoma in the eyes, as well as macular degeneration. As stated on a previous slide, sunscreen protects against both UVA and UVB rays. The recommended ones are labeled broad spectrum and are at least SPF 30. This is because SPF 30 sunscreens provide about 97% UVB coverage. However, sunscreen is a supplemental protection. No sunscreen can protect a person from 100% of UVB rays. This is why we wear protective clothes and look for shade. Let's go back to what to expect at events. So for setup time, there's a lot of stuff to set up for tabling at events, and some of the equipment we use for demonstration isn't exactly light. Depending on who our audience is as well, there will be certain items that will and will not be used on the table. Keep in mind the location of the event, where parking is available, whether or not the event is outdoors or indoors, and how many trips are needed to bring equipment from your transportation to the event. It shouldn't take more than 20 minutes total to get everything set up once you're there, although setting up for outdoor events may take a bit longer. Active engagement is basically talking to people. You explain who you are, the Nevada Cancer Coalition and SunSmart Nevada, as well as what you're doing, which is promoting sun safety and skin cancer prevention. There are a few little but no less important things to keep in mind for active engagement, though, such as your standing position. Where you place yourself and how you carry yourself at the table plays an important role in actively engaging your audience. If you're sitting behind the table with your shoulders hunched, looking bored, people can and will see this and avoid you. If you're standing at the side of the table, shoulders back and looking friendly and ready to engage, there's a higher chance of getting people's attention. And conversation levels. Depending on your audience's age range, the icebreakers will vary. Kids can be more willing to engage in conversations than adults when they see something interesting, such as any of our visual displays and items on the table, and if you have a friendly face on. You can start off with something like, "Hey, have you ever had a sunburn? How did it feel? Did you know that after a while, the sun can hurt you more? It can give you skin cancer too, not just sunburns." Adults are a little trickier to deal with, so I'll show you some tips for how to engage with them in other age ranges. The first tip to help getting people engaged with SunSmart Nevada is by flagging them down with our UV bracelets. Ask people passing by if they'd like a bracelet, then offer to demonstrate a neat trick by using the UV flashlight we carry to events on the bracelet to turn it purple. First, make sure that the flashlight is present with batteries, however. Then let the people know that as the bracelet will turn darker as it gets more sunny outside, and that even on cloudy days, UV exposure will still be present and have the bracelet change color. These bracelets are also effective for parents with babies who can't use sunscreen just yet. Inform the parent that they can use the bracelet under the baby's clothes when they take their child outside, and then have them check how dark the bracelet becomes when covered by the baby's clothing. If the bracelet becomes dark, then that means the clothes that the baby is currently wearing is not protective enough from the UV rays, and that the baby should have more coverage to avoid sun damage. The skin analyzer is one of the wow factors at our table, being really popular for getting people aware of sun damage directly on their face. People will usually be pretty nervous at first, but really curious ones will almost always go through with trying it out. First, you have to get them engaged before offering to let them take a look, since they usually won't know what the machine that they're sticking their heads into is. Again, this will only be mainly in use when an NCC staff member or a nurse is present. However, you can get them engaged with showing them the effects of sunscreen application while under the analyzer, as we'll show in the next slide. This video will show you how to demonstrate what coverage looks like underneath the skin analyzer. First, make sure that the participant is okay with putting sunscreen on their face at the time. Then, using just a little bit of sunscreen from either our dispensers or any other sources available at the moment, have the participant place the sunscreen on their hand, then stick their head underneath the analyzer while the machine is on. Then have the participant start to apply sunscreen on their face, as displayed in the video. If done right, their face should be covered in a darker purple shade from the sunscreen's UV protection, covering most of the sun damage shown on the skin. This is a good way to also show people how little sunscreen is needed for the face, and an estimate on how much sunscreen should be applied to other parts of the body when going outdoors. For our sunscreen dispensers, 1 squirt can be used for each arm, leg, and the face. If time allows it, we also strongly encourage you to take photos and videos of SunSmart Nevada at outreach events. Many times, the Nevada Cancer Coalition and SunSmart Nevada use these photos on their social media to show how our program is doing in the community. I hope that you found the information in this training presentation both useful and helpful for future volunteering. If you have any further questions, here's the contact information for Christine, the SunSmart Nevada Program Coordinator. Thank you so much for joining our program, and good luck!